What I have to say is going to sound super controversial. Maybe you're considering therapy. Maybe you're in the thick of it, yet you continue to struggle with depression or mood issues for a long, long time. My name is Leo, licensed mental health counselor, and one of the first questions I ask my clients is whether they've seen a primary care physician within the past year. This is because there are medical factors that can perpetuate mental illness. And sometimes medical factors are the sole reason for mental illness. One of those medical factors I'd like to talk about is vitamin D. Vitamin D is a fat-soluble vitamin, but technically it works more like a hormone. Your body produces it when your skin is exposed to sunlight, and it plays a major role in everything from immune function to brain development. We get vitamin D in 3 ways: sunlight exposure, foods such as fatty fish, egg yolks, milk, and mushrooms, and daily supplements. And vitamin D plays a vital role in our mental health and how our brain works. Vitamin D is found in many parts of the brain, especially areas that help with emotion, memory, and decision making, like the prefrontal cortex and the hippocampus. One of its key jobs is helping the brain make and use important chemicals like serotonin and dopamine. These chemicals help us feel good, stay motivated, and keep a balanced mood. Low vitamin D levels can mean less serotonin, which is often linked to feeling sad or depressed. Vitamin D also reduces inflammation in the brain and body. When we don't have enough, inflammation can go up. Research shows that chronic inflammation is strongly connected to depression. Finally, vitamin D helps your brain grow and stay flexible, which is super important for learning and coping with stress. It also supports your stress system, called the HPA axis, so your body doesn't stay in fight or flight mode for too long. Overall, if you don't get enough vitamin D, you might feel more stressed, make fewer mood-boosting chemicals, and have more inflammation in the brain, all of which can make it easier to fall into depression, especially if you've already been dealing with other tough stuff like trauma or illness. If the research isn't enough for you, check out some anecdotal reports, some of which I found here on Reddit from anonymous users, and their feedback is quite telling. Some even say that replenishing their vitamin D levels has been a night and day difference. Yet, an estimated 40% share of US adults may be deficient, and vitamin D deficiency is often undiagnosed. If you happen to be struggling with depression or mood disorders, and you are on a treatment regimen with a counselor, psychiatrist, or both, you must continue to commit your plan and follow medical advice. But also, have a dialogue with your counselor and psychiatrist about the possibility of medical conditions like vitamin D deficiency. Like, follow, and subscribe to my channel for more mental health content. And if you haven't seen your physician in a long time and don't know where to start, take this with you to therapy.